Hey guys, hope you guys all had a good Wednesday. We're gonna wait a few minutes to let other people join in on here. For those that might be running a little bit late. Let me pull this from my phone so I can look at the comments as they come in. And then we'll get started in just a minute. And then if you guys can hear me okay, just go ahead and put in the comments whether you can or not. So I'll make sure you guys can hear me loud and clear before we get started. All right, guys. So let's go ahead. We'll get started. So, for those that don't know me, I am Ben. I'm a physical therapist with Pro+Kinetix Physical Therapy and Fitness. If you are here to learn about squat mobility and how to do that properly and pain-free, and make sure that it stays that way, you're in the right place. So, all right, Dominic, awesome, thank you, perfect. All right, so let's get started with that and start tackling that. So if anybody's having any pain with regards to their knee or their hip or their ankle, let me know. One thing that I want to make sure that we address tonight is any questions that you guys may have. I don't want you guys leaving with any questions. All right. Super important that I answer all your guys' questions. So tonight we're going to be going over some assessments so you guys can determine, where are the restrictions occurring? When we do a squat pattern, or going squat down or sit down, we have to have adequate range motion at both at the ankle, knee, as well as the hip. If we don't have adequate range motion at the ankle, for example, then we have to have increased range motion at the knee and the hip. Okay? If we don't have that extra mobility from those other joints to make up for it, that's when we start seeing breakdowns and some injuries to pop up as well. Right, and this can span all the way up to low back pain, hip pain, knee pain, ankle pain. All right, and a lot of times the most common pain complaint that I hear is with regard to squat is in the knee joint. All right. And rarely is the knee responsible for the pain that it's experiencing. It's usually what's happening below the joint and above the joint. What's because the hip controls that knee, and so does that ankle. And so we want to make sure that we're not just zoning in too much on the knee joint, and start looking at these other joints as well and seeing if they're playing a factor into things as well. All right. So let's go ahead and let's do an assessment on the ankle so you guys can see if this is a joint that's causing some restrictions. Ankles and hips are usually where we see most restrictions. Usually knee range motion is pretty good in the general population, unless they're like post-operation or total knee replacement or something like that. But yeah, we see a lot of restrictions at the ankles and the hips. So let's go ahead and let's take a look at that. So what I want you guys to do is I want you guys to go up to a wall. All right, what you're gonna do is you're gonna take your foot, all right, and you're gonna bring it up to the wall like this. Okay. From there, once your foot or your toes up against the wall, I want you to try and take this knee and drive it to the wall. Okay. This should be your knee should be advancing directly over that big toe. Okay. So all of you guys should do okay with that. All right. So what I want you to do is we're going to go back up an inch and retest and do the same thing. And we're just going to go inch by inch. It doesn't matter what this back leg's doing. Okay. It should support you. All right, and then we're just going to go knee to the wall. Okay, I'm good there. So I'm going to back up another inch. Good there. Back up another inch. Good there. Almost running out of room. Okay. So yeah, that's my limitation. I'm at about 4.5 inches away from the wall. All right. So I want you guys to do the same thing on the other leg and start seeing how far away you're able to get away from that wall without that heel starting to lift up. Okay, we don't want that knee drifting in or drifting out. Okay, it should be advancing right over the big toe. And then we don't want to see that heel lift up. Once we start feeling that heel lift up, that's our body's way of telling us we've run out of ankle range motion. Okay, and so go ahead and try and test that. Okay, we're gonna do both legs there. All right, and I'm not gonna tell you guys the normal range of motions for this yet. Okay, I'm gonna wait until you guys are done here, so you guys don't cheat. Okay. And then make sure we're looking for any asymmetries as well. All right. So the research shows that we're actually better off having two equally bad ankles than one that's good and one that's bad. Right. That's how big of a factor asymmetries play a part into things. Okay. So you guys should be done with that. So what you guys to do is make a note of both sides there, both ankles. The normal range of motion for that is ideally 3 inches away from the wall. Okay, that's just for normal walking pattern. Okay, for us to have a normal gait or walking mechanics, we need 3 inches. If we don't have that 3 inches, then we're gonna start seeing some compensations occurring with regards to our gait analysis and whatnot. All right, so some compensations can be where we're starting to swing the leg out. I'm exaggerating, okay, but it'll be more subtle where people will walk and it'll just be kind of like circle out a little bit. All right, another thing that we see is when people toe out. They start walking with their feet pointed out like that. Okay, and that's to make up for lack of range of motion in the ankle if we don't have those 3 inches. So if we're running and proper squat mechanics, we want ideally 4 to 5 inches there. Okay, if we don't have that, then we're gonna start needing extra range of motion at the knees as well as the hips. Okay, so hopefully that all makes sense. We're gonna go over some exercise to address that. Okay, if you guys had any restrictions, all right, that's what we're gonna tackle first, and then we're also gonna look at the hip as well. All right, if you guys had any pain with that, let me know too. Okay, everything that we do tonight should be pain-free. Okay, nothing should be painful. Okay, so we're gonna do the best way to stretch and loosen up muscles is a combination of foam rolling and stretching. Okay, so I'm gonna show you guys how to foam roll the calf muscles, and I see this done incorrectly time and time again. Okay, so what you're gonna do is you're gonna grab a foam roller. You could also use like a frozen water bottle too if you don't have a foam roller. And what you're gonna do is you're gonna start with your calves, okay, placed on top of the foam roller, and then we're gonna go just up and down the entirety of the calf muscle, all the way down to the ankle, all the way up to the knee joint. Okay, so this calf muscle wraps all the way around. Okay, it starts from here and goes all the way around to over here. Okay, but I usually just see people foam roll with their toes pointed straight up. We're only getting about a third of the muscle when we do this. We also need to rotate out and do the same thing. Okay, now we're hitting the outside part of the calves. Okay, and then also we can turn and point our toes in and foam roll that way as well. Okay, and ideally we want to be foam rolling for a minute or two. Okay, we don't want to overdo this. If we want to make it more intense, we can cross one leg over the other and do the exact same thing. Okay, then one way to make it even more intense too is like right now I've got a knot on my left calf. So what I'm going to do is I'm going to pause and hold on to that knot and then go ahead and bring my toe up and then push my toe back down. And what this is doing is it's pinning the muscle over the top of that foam roller. And then by moving our foot back and forth, we're pulling that muscle over the top of it and it's helping to release it. You can just do like 10 oscillations there, nice and slow. We don't want to be going too fast with this. Okay, it should be slow and controlled. You can do the same, find another knot on the other side and do the exact same thing. So ideally 2 minutes each leg. All right. And if you guys are runners, this is one super important as well, before and afterwards. Okay. So key point, make sure that we're doing it with the toes pointed out and then also the toes pointed in like this. Okay. All right. So like I said, best way to loosen up muscles, not just the calf muscles, a combination of stretching as well as foam rolling. Okay. So we're gonna move on to some stretches for the calves. And this is something I see done incorrectly all the time as well. Where I see people just stretch one of the two calf muscles. A lot of people think the calf muscle is just one muscle. It is actually made up of two different muscles. One attaches above the knee joint, one attaches below. Okay? And I see a lot of times people are just stretching the gastroc. Okay? The gastroc is one of the calf muscles. The other muscle is the soleus. So what we're gonna do to stress or stretch the gastroc, so we're gonna put the leg straight back like this, and we're gonna bend our knee here slightly, okay, in the front. It doesn't really matter too much about what's going on in the front leg here. We just wanna keep this back leg straight, right? And then what we're doing is we're just pushing into the wall, trying to keep that back leg straight. We should feel a nice stretch in the calf. Right? Ideally, you're holding this for about 30 seconds. And then with regards to stretching, we ideally want to be doing 3 sets of 30 seconds. But today, just for time purpose, I want to make sure we get through as much exercise and stretches as possible, and you can do them on your own. All right. So let's go and switch and do the same thing other side. And again, notice to see if there's any asymmetries. Right? Most likely, the side that you had limited range motion on over here, that's the side that's going to feel more tight with these stretches as well. I get a lot of questions. Well, should I just be stretching the tight side and not do anything with the other? No, because before you know it, that bad side is going to be the bad side is going to be the good side. Then you're just playing a game of catch up. All right, it's important to do both sides equally. All right, helps bulletproof the other side too. Okay, so now we're gonna switch back to the right leg. Instead of keeping that back leg straight, well, we're gonna start with the back leg straight, and then what we're gonna do is we're gonna take our knee and drive it kind of down to the floor. Okay, but we don't want our heel coming up. You guys feel my heel's coming up now? We want to keep that planted firmly on the ground or the floor, and then we are just driving that knee down, and we should feel a little bit more of a stretch lower on that calf muscle. And again, none of this should be painful. All right, and let's switch and do the same thing other side. Make sure to keep that heel down. If you guys start having pain with any of these, stop. Okay. And if you guys want a copy of this mobility routine, just enter it in the enter your email address in the comments, or you can private message me within the group, and I'm happy to send this to you guys as well. Okay, I'll have a video description, written description, how many reps, how many sets, and how often you should be doing this as well. Okay, so just let me know if you want that routine when we're done. So those are the 3 best exercises for ankle mobility. All right, there's a couple other stretches and exercises you can do to help loosen up the calf muscles, but this is like the low-hanging fruit. All right, we need to maximize these stretches before we start moving on to some more other complicated ones. Okay, because this is where we're gonna get the most bang for our time, okay, and effort. So we need to start there. All right, that leads us into the hip. Okay, so what we're gonna do here is go over some hip assessments and stretches, and see if we can loosen this up too. And this will help give you guys a sense of where are your restrictions at. Are they in the ankle? Are they in the hip? Okay, and then you can target those more directly instead of what I call it's like blindly just throwing darts. Okay, darts being the exercise. I see this all the time. People go on YouTube and search what are the best exercises for knee pain, or best exercises to improve knee range motion, hip range motion. Okay, there's ones that fit the general population. Okay, but a lot of times you just need an individual specific assessment done to determine where are your restrictions at. So hopefully these assessments will help narrow it down. All right, so what I'm gonna have you guys do is you're gonna go ahead and lay on your back. All right, and so this stretch is also a way for us to do an assessment. Okay, so what you're gonna do is you're gonna cross this right leg over the left. Okay, and what you're gonna do is you're gonna take your hands, place them behind the knee, and then you're going to pull gently to the opposite shoulder. So if you're holding on to your right knee, you wanna be pulling to that left shoulder. You should be feeling a good stretch in that right glute. Okay, so this muscle that we're stretching is called the piriformis. It's a very, very small muscle, and it's very prone to getting tight. The reason this muscle gets tight is if the large glute muscles aren't doing their job. Then the small little teeny bitty piriformis gets tight and overworked, and then it can cause hip range of motion issues, and it can cause sciatica, okay, pain down the back of the leg, down into the foot. Super common. Let's go and do the same thing on the other side. So a lot of times people that have sciatica will come in and see me, and I ask them what they're doing, like, oh, I do stretches and foam rolling, and it makes it feel better for a day or two, but I have to continuously do it. So mobility exercises are great. However, a lot of times they're just treating the symptoms. You got to figure out, why are these muscles getting so darn tight in the first place? And a lot of times it's due to compensation, okay, and weaknesses in other areas of the body can be occurring above or below that joint even. The body is highly complicated and interconnected. Okay, so I want you guys to kind of make a mental note. Did you feel like it was more intense on the left side or the right side? Okay, if you felt it was more intense on one side versus the other, most likely that hip range of motion is a little bit limited on that side as well. Okay, so we're gonna do another one. Okay, so instead of pulling, now we're gonna be pushing away here. Okay, and again, make a mental note of what you're feeling here and the intensity of it. And also make a note of, how far away are you able to push? Are you only able to push this far away on one side and then able to get this side on the other? That's your way of knowing if there's any asymmetries that are going on. So this will help loosening up a different area outside of just that piriformis that we were working on earlier. That's kind of working in the hip capsule. And again, make sure we're not pushing too hard into these stretches. Okay, it shouldn't be too painful. If we start experiencing pain, what the muscle is going to do is it's going to contract to protect itself. And if it's contracting, it's not going to be able to stretch effectively. Okay, so it's super important not to be pushing too intensely into this. Okay, so we're going to do the same thing on the other side. So I'm a little bit tighter on this side comparatively. You may feel this kind of back here. You may feel it kind of in the hip joint as well. Everybody's gonna be a little bit different. And again, ideally holding for 30 seconds. Another strategy you can do is focus on your breathing and do 6 deep breaths instead of counting to 30 seconds. That helps your body relax. If it's helping your body relax, it's going to help that muscle that we're trying to stretch relax, and then the stretch is going to be more effective. We're not going to get so much muscle guarding or that muscle contracting trying to protect itself. Okay, and relax. Okay, like I said, the best way to loosen up a muscle is a combination of stretching as well as foam rolling. Right, so what we're going to do is now we're going to foam roll that piriformis muscle. Okay, and this muscle is very responsible for restrictions in squat depth. Okay, so what we're going to do is we're going to cross one leg over the other, and we're going to kind of roll on that glute or that piriformis muscle. And you'll know when you hit the spot. Okay, it's going to be pretty intense. And you can kind of rotate back and forth. You can roll on it. Again, you're ideally doing about a minute or two here. Okay, let's go and switch into the same thing on the other side. Okay, so now what you're doing is you're crossing the right leg over the left. And again, rolling on that piriformis muscle. You can, if this isn't intense enough, what you can do is you can use like a lacrosse ball or a tennis ball or a softball or something like that to make it more pinpoint. All right, and relax. Okay, so those are the 3 best hip exercises, as well as the 3 best ankle exercises to help start freeing up those joints. Okay, it's going to help allow you to get into a deeper squat, Okay, it's also going to help decrease any pain that you might be having as well, because now the joints are able to operate and be utilized the way they're supposed to. All right, so I'm going to kind of give you guys a recap on, why is this so important, okay, and why we need this ankle range motion, this hip range motion. Okay, so a lot of times people have experienced knee pain because of the way they squat. So we're going to go over the proper way to squat too, because I know you guys have probably heard so many different opinions on this. And again, this isn't my opinion. This is what's based on research. Okay, what do biomechanical and mechanical engineering research articles state? What does medical literature say? What do these physical therapy articles say? And it's all conclusive and consistent with what I'm going to tell you today, okay, and what we've been going over already. Okay, this again, everything that's based in my practice is not based on our opinions. Okay, it's based on what's the best available research out there. Okay, so what we want to do with the squat is ideally want to get about shoulder width apart. Okay, again, everybody's torso is a little bit different length. Everybody's femur or their thigh bone is a different length. Everybody's got different shin bone lengths, stuff like that. And so it can change up the squat for that pattern a little bit. Everybody's squat pattern is going to look a little bit different. However, they should follow a very similar pattern. Okay, so ideally about shoulder width apart. You can have your feet pointed straight ahead, or you can kind of toe them out a little bit. We don't really need to usually, like, based on people's anatomy and skeletal system, rarely ever do we need to be going out this far. Okay, they'd actually probably have a skeletal abnormality. I rarely ever see somebody where they need to toe out more than this. Okay, this is about what I do. Okay, so I'm toeing out just a tad bit. I'm not straight ahead. All right, and then from there, what we're doing is we're unhooking our knees. All right, and then from there, we're sinking our hips back and then going down and then coming back up. Okay, we need to keep that chest up. What I see a lot, I'm going to kind of demonstrate from a side view too. Okay, so you can see how I'm getting my hips back. You see my knees? They're kind of like lined right over the toes. They're not jetted out way far past here. Okay, I'm activating my glutes now and my hamstrings to produce this force. I'm not relying so much on my quads, which is what we want. Okay, keep that chest up and then back down. Keep the toes planted on the floor. We don't want to be rounding out like this. Okay, toes planted in the ground. Weight should be evenly dispersed between the heel as well as that forefoot. All right, one other thing I see a lot of people do is, I'm going to show the two faults that I see a lot most commonly that lead to injury. All right, one is that they put way too much weight on their forefoot. Okay, they let their heel come up, and what they're doing is they're keeping their torso very upright and they're squatting like this. Okay, do you guys see the difference between this and this? Right, so this is a very quad dominant squat. Okay, where we're using the quad muscles quite a bit. All right, and this can increase compression and stress on that knee joint. We need to make sure that we can tap into and use our glutes and our hamstrings. We do that by pretending that we're sitting in a chair. Okay, so what you can do is you can put like a box behind you, okay, or a seat. Okay, so if I went to do a quad dominant squat, okay, where we're doing it incorrectly, if I went to sit in this chair, I'd miss it. Right? Do you guys see that? I would almost miss that chair. Okay, now watch when I use my glutes and my hamstrings. Now, do you guys see how far back in that chair I get? Like it's perfect, right? I'm all the way to the back. Okay, quad dominant squat, I'm gonna be like right on the edge. Okay, that means I'm using too much quads, and that's gonna put more stress on that knee and lead to knee injuries. Okay, so sit back, pretend you're trying to sit in a chair, tap, come back up, tap, come back up. All right, that's one common fault. Next one would be letting the knees collapse in. Okay, so what I mean by that is knees are going in like this. Okay, we want to make sure we keep the knees out. All right, one way to do that, one trick is pretend that you're trying to screw your feet into the floor. Okay, trying to separate the floor. Okay, watch what happens to my knees as I try and separate the floor. My feet are turned off. Now watch as I try and separate the floor, okay, and turn my feet outwards, but not actually doing that. Look what happens to my knees. Now they track out. I'm activating the glutes the way I'm supposed to. Okay, and there's those are tips to kind of override those faults, okay, and those common misconceptions of the squat. Right. One thing is I want to make clear though is knees going over your toes necessarily bad? No. However, somebody comes in with knee pain, I'm not going to be doing it, having them do deep squats with the knees going over the toes, because that increases compression in the knee joint. However, and we want to eventually reintroduce that, because everybody should have the capacity to do that. I guarantee if you look at the way you go up and down stairs next time, you'll notice that your knees have to go over their toes when you're going down and upstairs. It's just natural. And you have to have that capacity to do that. All right. So hopefully that all makes sense. All right, with regards to the squat form and the mobility exercises. Okay. Because if we don't have the adequate ankle range motion, it's going to start working its way up into the knees and the hips. Okay. And if we don't have adequate range of motion there, then we're going to start seeing some low back pain as well. Okay. All right. Before we end, I'm going to kind of talk a little bit about low back pain with squats, because we see it a lot. So a lot of times when we go into a deep squat, what I see is you see how my low back is arched? Okay. Everybody should have a low back arch here. Okay. But as we go deeper into the squat and we run out of hip range of motion, what happens is a butt wink. Okay. Butt wink is where my pelvis kind of tuck underneath. Now do you see how my low back is rounding out? Okay. It's here versus here. Okay. And this happens when we go deeper into squat and don't have the adequate range of motion. Okay. And this can lead to low back pain. Okay. Especially if we're loading up with squats and doing, throwing 150 pounds on our back or something like that. That's when we really start seeing disc herniations and low back pain because of it. Okay. But yeah, hopefully you guys found this all beneficial tonight. And again, if you guys want a copy of this routine, now don't want to have to watch this on replay for it to make sense, just direct message me, or you can put in the comments that you'd like me to, and I'll reach out and get your email address. But most importantly, guys, do you guys have any questions or concerns on anything that we covered tonight? All right, like I said, most important thing is I don't want you guys leaving with questions. All right, I'm here to answer any questions. So if you guys have any, go ahead and put those in the comments while we wrap up. Or if you guys have individual pain that you're experiencing, we can tackle that too. Okay. Yeah, main thing is to know that just because you're having pain with squatting does not mean that you have to keep dealing with it. So many of our patients have gone to previous physical therapists, previous physicians, and the physicians are telling them, oh, well, if it hurts only when you squat, well, just don't squat. All right. Well, that's ridiculous, because you should have the capacity to do that. It's so functional. You need to do that. Can you imagine, especially if you're 30 years old right now, and down the road you keep putting this off? By the time you're 60 or 70, you're going to have difficulty going up and down from a chair. Okay, because that's essentially a squat. Okay, you're squatting when you go from sitting to standing. You need to have that capacity to do it, and if you don't take care of it, it's going to lead to issues down in the future as well as we age. Okay, especially as our muscles start deteriorating a little bit. Okay, and our muscle or our bone mass deteriorates as well. Okay, but yeah, I appreciate you guys coming tonight. All right, and then if any questions do pop up, or you're watching us on replay, just go in the comments and ask whatever question you have, and just make sure you tag me or type my name in, so I get a Ben Boggy, so I get a notification of that as well. Okay, so I can, and then happy to answer any questions that way too. Okay, but yeah, I appreciate you guys coming tonight, and I hope you guys enjoy the rest of your Wednesday night. All right, bye.